Today our topic is going to be a pregnancy in third trimester, and Dr. Ibrahim and Dr. Stevens are going to be presenting, and we just want to thank you. And if you have any question, ladies, please ask as we go along. And in any of you that need interpretation, please let us know that we can interpret. And if you have a question, you can put it in the chat, or we can just answer as we go along. Dad manugud dhex jira oo aan garanaynin Ingiriiska oo loo fasirayo insha Allah. Okay, so everybody understands English, nobody needs translation. Dr. Ibrahim and Dr. Stevens, you guys are good to go. Thanks for coming today, and the mic is yours.
Wonderful, thank you for having us. Me and Dr. Stevens were just gonna pop on quickly to kind of talk about flow, but Heather, we can just alternate every other slide if you are comfortable with that as well.
That sounds great.
All right, so, oops, let me see. Oops, hold on. All right. So in the third trimester, typically it's between like 27, 28 weeks to 40 weeks. We're going to be talking about what is happening in the pregnancy, what to expect from your or somebody's changing body, and what to expect from the doctor or provider that's providing care for you or your client.
So, hi everyone, my name is Heather. I'm one of the, I work with Dr. Abraham. I am one of the third-year residents at the First Club Clinic. There is a lot happening during pregnancy, and I think sometimes it can be really hard to keep track of all of the appointments and sort of this like long checklist of things that people recommend during pregnancy. And so Dr. Abraham put together this amazing presentation to kind of go through those, like run through things to expect that happen in your body, and like things to expect that your doctor might suggest during your pregnancy. But your body's incredible, and during the third trimester of your pregnancy, your baby, like that's when the baby gains the most weight and physically grows the most. And that's also an important time for when their lungs mature. You might have had friends or family who have had babies earlier than their due date, and have heard about sort of some of the complications that come from lung development. So that last trimester, those last few weeks is really when baby's lungs finish maturing, and and then by the end of the third trimester, the fetus usually is around 6 to 9 pounds, but that weight is really variable depending on how big parents are and exactly when the baby is born in the pregnancy. So all these things can vary a lot from person to person.
Around like the 36th week, you might notice that like the baby's head is dropping down into the pelvis, and when the baby kind of gets bigger, I've definitely had patients come in a little bit worried, come into triage or come into clinic worried because they're not noticing the baby move as much, especially kind of towards the end of the pregnancy. And that's normal. You should always still be able to feel your baby move, but you might just notice that baby is not as active anymore because it's getting a little big and getting a little crowded. And when the baby's head drops, it's kind of starting to get into the position for delivery.
So some changes in your own body or the pregnant person's body that they might notice in the third trimester is that there's just kind of less room in your belly because baby's getting bigger and bigger. And so baby might press against the bladder and make basically like give your bladder less room to fill with urine. So you might have to urinate more frequently and feel that pressure on your bladder. You might have increased vaginal discharge. And a lot of people experience different vaginal discharge during pregnancy, but especially those last few weeks, you can have more like white, thick discharge, or clear mucousy discharge. And that is important to recognize the difference between discharge and when your water breaks. And so discharge will be like thick and sticky, and kind of stick to your underwear. And then like when your water breaks, that's really like liquid, that will like soak your entire underwear. A lot of people have issues with constipation in that third trimester. And definitely if you experience that, you can talk to your doctor about ways to increase fiber in your diet, try to stay really hydrated. And there are certain like laxative or fiber medications you can take that can help with the constipation. And then the last thing is, or not the last thing, there's many changes, but the other last thing that we wanted to highlight is that you can also feel practice contractions, or Braxton Hicks contractions is another name for them. And that's basically like your stomach and your uterus tightening and then releasing. They're usually not very painful, but just kind of feel like your muscles are contracting. And that's your body kind of like getting ready and basically strengthening and practicing for when you start to go into labor. And so that's really normal during the third trimester.
I just was thinking of some other things too to add to this in terms of like constipation, and Dr. Stevens had talked about like some things that you could do, like also like over the counter, like Miralax, or even taking like an Epsom salt bath, because the magnesium in the Epsom salt, it can act like a laxative, and so it's relaxing to your body, and it also kind of soaks into your body. You get that magnesium into your system, and then you can have like a nice relaxing poop instead of having to strain, which can be really problematic for some people in their pregnancy.
Mm-hmm. Can you talk a bit more about the difference between Braxton Hicks and preterm?
That's a really good question. Braxton Hicks contractions are usually like the top of your stomach, or like your whole abdomen, and feel like your muscles tightening, and usually happen sort of like throughout the day. They usually don't last like more than a couple of minutes, and they're not super painful. When you start to go into labor, that's when the contractions are going to be much more painful and strong, and they might feel like cramping lower in your pelvis, and you might start to feel pressure in your pelvis when those contractions are happening. So the Braxton Hicks are more like muscles hardening and your stomach getting hard, whereas labor contractions are painful and they last a little bit longer. You might have pressure in your pelvis, and they are happening like in a pattern. So like you'll have a contraction every 10 minutes, every 9 minutes, every 8 minutes, and those contractions will be continuous, and they'll start to get closer together and more intense. Do you have anything to add, Dr. Abraham?
Yeah, I think sometimes you might notice that like Braxton Hicks can sometimes go away, like if you change like positions, or if like sometimes empty your bladder, or if you're a little bit dehydrated too, you can get a little like uterine irritation and some like contractions with that. And so noticing that, like if they are getting stronger or more regular, and you start to get, or your client starts to get like kind of pacey, or just that uncomfortable sensation, that might make you think maybe I need to talk to a doctor or go to triage or something like that, just to double check. And the difference then would be that Braxton Hicks is over, or labor contractions, preterm labor contractions, or early labor contractions, typically over a certain amount of time, a few hours, will lead to a change in your cervix thinning or dilating. And Braxton Hicks should not lead to a significant change in your cervix dilating. Did that answer the question? Or
Yeah, that was beautiful. Thank you.
More things that can happen to a pregnant person's body in the third trimester. Sleep might become more challenging, might just be hard to find like a good position, not just sleeping, but sitting, really doing anything can be kind of problematic towards the end of the third trimester, especially. Some people even start to notice that their breasts start to leak. Some people even notice that you might even start to notice that if you are in labor. I've seen that happen sometimes where people's breasts start leaking before like the baby is coming. That's normal. You might have experienced things like acid reflux or constipation or increased urination throughout. Like even for some people, they notice it early in their pregnancy. That might be a tell for them that they're pregnant. But it just gets worse as the pregnancy moves along. And that's kind of the same thing, reasons why Dr. Stevens had talked about it before, is just there's not a lot of space. And so you're just like, the baby's kind of pushing up on the stomach and the diaphragm and kind of creating extra pressure, so that acid from your stomach is kind of coming up into the throat. There's this thing called lightning crotch, and it feels exactly like it says, like maybe a few seconds long of like electric shock feeling in your pelvis. And that's different than what can also happen in the third, or even sometimes for some people, second trimester, of round ligament pain. Some people say that lightning crotch, which typically happens like in the third trimester, is when the baby's head drops into the pelvis and the bones of the pelvis start to relax and separate a little bit, and the baby's head kind of is, and as that is doing that, there's some nerves that get hit by the baby, and it creates that kind of a shock-like sensation. It can be very surprising to people, and it is quite painful. I guess you could say silver lining is it doesn't last forever. It's a quick burst, but it can be, you can just be doing your everyday thing and then all of a sudden it happens. But typically it's more associated when you at night when you're not moving, and then you change position, you'll notice that, but it can really happen at any point.
Can I add two more?
Yeah.
Before we go on, just like you're saying with baby moving lower in the pelvis, another one's round ligament pain, which is basically like there's these like ligaments or sort of like strings that hold your organs in place, and as baby gets heavier and bigger, they get stretched a little bit, and so those can be uncomfortable. You can have some like aching or sharp pain in your groin after standing or walking for long periods of time. And things that can help with that is like a pregnancy belt, something that can help hold your belly up and take some of the pressure off of your round ligaments, and also just like resting and making sure that you have frequent breaks if you're like walking around or standing. And then another one is pubic symphysis pain, which is exactly like Dr. Abraham was describing. There's those like pelvic bones, like that as during pregnancy gets stretched a little bit. And so right sort of in the center of your groin, you can have some pain there. And as your pelvis sort of like stretches and gets ready to give birth. And one thing that can help with that is, again, they call it like a pregnancy belt or like a hip binder. And it's basically like a belt that goes around your hips and provides some like extra support and kind of like helps get some pressure off of that pubic symphysis where your bones are joining together.
Yeah. In addition, other things that can be helpful is like gentle stretching and like Tylenol. And if it becomes kind of severe, you could even talk to your doctor about referral to pelvic floor physical therapy as well.
Something that's on
massage, like a pregnancy massage.
Yes. Yeah. Mm-hmm. With like round ligament pain, and even like, I would say like pubic symphysis pain, like the things that would work for what you consider like a muscle strain would also kind of be the same types of things that you would do for round ligament or like pubic symphysis pain. With lightning crotch, it's a little bit different because that's more like hitting, like a nerve being hit, versus the pain that comes from a ligament being stretched, or like the pubic symphysis. And some people that have that pubic symphysis pain, it's like more constant and more frequent than lightning crotch.
Yeah, if you guys have any questions, please do interrupt us. Another thing that a lot of people have questions about is how much weight gain to expect or sort of plan for during pregnancy. And I think that it's important, there's the caveat to talking about sort of ideal weight gain during pregnancy is that everyone's body is different. And a lot of times sort of the schedule changes and stressors around being pregnant, it's hard to like be perfect with the amount of weight gain, or like, you know, sometimes people gain too much or don't gain enough and go on to have really healthy pregnancies. But like all things, we do have general recommendations for what we deem like the ideal amount of weight gain. And that's based on how much the person weighs before they actually get pregnant. So we base that on their BMI, or their body mass index, which is a calculation that we do when we look at people's height and their weight together. We do a little calculation that says more or less what their like the general amount, or like generally if we would consider them being overweight or normal weight or obese. And so the weight gain recommended is a little different for those categories. So depending on your BMI, the amount of weight gain recommended ranges anywhere from 11 to 40 pounds, which is a huge difference. But it's sort of unique to each person. And just like we're saying, it's kind of like, you got to take all of this with a grain of salt, because everyone's body is different, everyone's metabolism is different. And the most important thing is that you're eating healthy foods and you're staying active during your pregnancy. But these are the general guidelines for the amount of weight. And the reason that we care about how much weight people gain during pregnancy is because if you start off at a heavier weight and then you gain a lot of weight during pregnancy, it can cause some complications during birth. It can like increase your risk for shoulder dystocia, or sort of like complications when baby's actually coming out. Or if you have to go to C-section, it can make the C-section a little bit more complicated. And also, if you don't gain enough weight during pregnancy, that can sometimes mean that baby's not getting all the nutrients they need to grow. But again, these are all things with a grain of salt, and babies are very resilient.
A phrase that you hear a lot is, "Oh, you're eating for two now," which is not technically true. Eating twice your caloric need, or how much your body needs in terms of calories to kind of sustain itself, can actually lead to unhealthy weight gain. Instead, I like to think of it as like eating twice as healthy. And starting around the second trimester, again, depending on your BMI, which, if I were to get on my soapbox, is problematic in itself. And I appreciate the way Dr. Stevens had phrased everything before about weight and weight gain. You will need about 340 calories, additional 340 calories a day if you're pregnant with one baby. And what is 340 calories? So basically, that is just 2 full fat mozzarella sticks and a fourth cup of almonds, which is around 300. 1 plain bagel with 2 tablespoons of cream cheese is around 350. And so it's really not that much that you need to start increasing your calories per day. In the third trimester, you need a little bit more, and that's around 450 calories a day. And a great website is myplate.gov. They also have an app as well, and they can kind of help you make some good choices around like healthier options for things. And I also use, like right now, even sometimes MyFitnessPal, it has a similar feature where you can even scan like a QR code of like something that you're eating, and it'll bring up all of the like nutritional information. And if you like, it'll tell you like out of this bag, like a serving is this much. Sometimes I eat a full bag and I have to calculate the entire bag and what that serving is. But it kind of, I do it a lot to see like, what is it that I'm eating? And I'm very surprised. So I always encourage people to like use an app like that or myplate.gov just for a short amount of time, because I feel like it's very enlightening to kind of to realize like what we're putting in our bodies too.
Great. Thank you, Dr. Abraham. So in talking and thinking about food during pregnancy, there are a few foods that we recommend avoiding during pregnancy. And that's because some of these foods can carry bacteria that are not harmful to adults, because we have really robust immune systems and digestive tracts that can keep us safe and protect us from this bacteria. But babies don't. And so there are some foods that we recommend avoiding because they might carry bacteria that when you eat them, you'll be fine, but in your pregnant state or with the baby, it might get an infection. So things to avoid is raw seafood, unpasteurized dairy. Both of those can contain some different types of bacteria. Soft or unpasteurized cheeses, undercooked eggs, pre-made deli salads, so like potato salad or pasta salad or chicken salad. Those they have this like specific type of bacteria that can grow. That again, as adults with full-blown immune systems, we're fine if we eat that, but the bacteria in there can affect a baby. Raw sprouts, cold hot dogs or lunch meats. So like that includes deli meats, like buying like packaged, like meat in the store that's already cooked and sliced, or then undercooked meat or poultry. And another thing that is not a food, but that should be avoided because of similar like bacteria that can be present, is taking care of cat litter boxes. So if you have cats or if your family has cats, try to avoid coming into contact with their litter box. So have someone else in the family change their litter box, and then try to like wash your hands after being around the cat, because their poop or stool can contain some bacteria too that can be harmful. But like with all these things, this is the recommendation to avoid all these things. If there's a slip up and you realize, oh my gosh, there was some soft cheese in what I just ate, you'll probably be fine. This is all like with an abundance of caution. The safest thing is to avoid these foods. Any questions about that?
One more thing I'd like to add too is I know it's a focus to kind of talk about like racial inequities and in the reproductive justice. The rate of listeria, which can happen when you eat like unpasteurized juices or milks or soft cheeses, is actually like 24 times greater in Latinx communities than the general population, which is about, for a pregnant person, they're 10 times more likely, but in a person that identifies as Latinx, they're 24 times as more likely to be infected with listeria. With listeria, oftentimes you yourself might not feel sick, but that bacteria has a special property that can like penetrate through the placenta and infect the baby. And so that is something to kind of like keep in mind. Like it's important to like as always, but even more so important, like always wash your hands and clean surfaces before you eat. Separate raw meats from the rest of your foods that you're cooking. Make sure that your foods are cooked at the right temperature for the type of meat that you're cooking, and make sure to put your foods immediately away in the fridge after eating them. Another important aspect
About the Latinx community, what do you mean by that?
like anyone that identifies like sometimes it is previously called like the Latino community, anyone from like Central America or South America is 24 times a pregnant person that identifies from that community is 24 times greater to get listeria during pregnancy.
Thank you.
So that has something to do with the type of cheese that community tends to consume. Is that what it is with the soft cheeses that are pasteurized? Is that why that is?
I think, yeah, queso fresco, I think has, it's like unpasteurized.
Mm-hmm. And it's also like in certain communities, like unpasteurized milks are like traditionally drank as well. And especially some of people that identify in those communities are also like migrant workers that work in like agriculture, and they might have like access to some of these and are able to like bring some of these foods home, which but sometimes that can be also dangerous if you're pregnant. Okay, so we had talked about it's also important to kind of move your body. And so we want to aim for an average of about 150 minutes of moderate intensity exercise every week. And the way I think about moderate intensity, it is really different for everyone, but I try to say like if it's a little bit challenging for you to talk while you're exercising, that's like a good mark that you've hit like moderate intensity. And if you're not somebody that has really exercised before, you don't need to be like, okay, I need to go hard in the paint and start exercising 150 minutes at moderate intensity every week. Just start slow, listen to your body. Your body knows best, and you can increase your endurance that way. You might also notice that if you were someone that did work out, you might notice it's really hard for me to work out at the way that I used to. And that's also because your body is changing. And so just be gentle and mindful of pushing yourself too hard. Like in anything, even when you're not pregnant, it's always important to drink plenty of water, but especially when you're working out. It's as you grow, as your body grows, as your breasts get bigger, your clients' breasts get bigger, supportive clothing is important, especially we were talking about like some of the issues of like pubic symphysis pain or around ligament pain, having like a really good supportive like leggings or things like that can also help prevent injury or stress on the ligaments, especially as you go along your pregnancy, become more stretchy, and that's his body is preparing to give birth. You might notice a little bit more like joint pain, but supportive clothing can help with that. Types of workouts that are okay to do is walking, swimming, weightlifting, balance training, yoga. Really, most sports you can do. Things that are high impact or you have risks of falling would be sports that you might want to avoid.
Included in the supportive clothing, if you're like walking or on your feet a lot, sometimes people find compression stockings help because like some swelling and in your lower legs can be uncomfortable and can happen a little bit more frequently when you're pregnant. And then one other thing to highlight is staying really active and getting up and walking around every day also reduces your risk of blood clot, which is really good. And going along with swimming, it's recommended to not, if you do end up going to like a community pool and swim, it's recommended to not get into hot tubs when you're pregnant, because being at that elevated temperature, for whatever reason, it's not great for the baby as they develop. So it's good to stay away from hot tubs and just be in the swimming pool, which is totally safe.
How about the ocean?
Yeah.
That's fine. Yeah. I mean, obviously be safe, as safe as you would be if you weren't pregnant. And think about tides and things like that. And I would always make sure that there's a lifeguard on duty wherever you're swimming, but the ocean is totally safe.
Swimming around here in the ocean is hard to imagine. It is so cold. Oh, go ahead, Jesse.
Oh, sorry. Yes. Okay. Go ahead.
So we are rapid reviewing so many different aspects of pregnancy, and it's 9 months. There's a lot that happens in your body and a lot to keep track of. So I think like the most important take home point is that we'll go through a list of common questions for doctors, but the biggest thing is to know that you as a patient have every right, if you have a concern or a question, or you want to like know your options for different things, it's totally within your rights to ask your doctor. A lot of times clinics have or have your client ask you, because you all people who encouraging them to ask you questions too. But a lot of times clinics will also have like OB nurses who can answer questions too. So even if you don't always have to have an appointment to ask a simple question. But things that are important to keep an eye on yourself and make sure you have a conversation about is if you notice that you're gaining weight really rapidly, talk about options for your birth plan. A lot of clinics or hospitals, as you all know, will have like forms that you can fill out that kind of highlight options for their hospital, like if they have a tub, or if they have aromatherapy available, or if you can bring your own, and you can kind of like go through options for that. Think if you have really severe cramping, you can go to talk through what it feels like for you if you have Braxton Hicks, or if you're having really severe cramping and you're concerned those are like early contractions. Anytime you have vaginal bleeding or leakage of fluid, that's really important to tell your doctor right away. And then pelvic floor PT, either as Dr. Abraham was mentioning, for like pelvic pain, or for a referral for postpartum recovery. That has really helpful for a lot of people, and helps with preventing incontinence or managing pain after delivery. Usually we recommend, or usually the pelvic floor PTs recommend waiting like 6 weeks postpartum, just because the tissues are healing and the muscles are recovering. And the main goal of those first 6 weeks is to just recover and let tissues recover. And then after that, you can be referred to pelvic floor PT. And then immunizations. So both for pregnant people and for their families who will be around babies, it's the vaccines that we want to highlight are flu, COVID, and Tdap, because those are going to reduce risks of the really communicable diseases that can affect babies most severely. And I think flu and COVID are ones that are really easy to ask about and are offered every year. I think that Tdap, which stands for tetanus, diphtheria, and pertussis, is another. It's really important to ask about that one. A lot of people are, that's a vaccine that you get as a child, and then it's recommended to also have a booster as an adult. And it's important to make sure that people are up to date on that vaccine, because that last letter, the P, stands for pertussis, which is whooping cough, which can be really dangerous for children. And a lot of adults are overdue for that vaccine. So just when you're in your 3rd trimester, making sure that people that are around you, your loved ones who are going to be around the baby, are fully vaccinated, so you can reduce the risk of baby having an infection.
That can you hold on a second? Gabdo, dad manigu jira oo u baahan turjumaan in loo turjumaano.
And I was actually, I was here when we did the COVID talk too. So I know we've talked about this a lot, the COVID vaccine. But happy to answer any questions.
Oh no, go ahead, go ahead. Until how long mom can have her COVID vaccine till she gives birth?
At any point.
Oh,
at any point. Honestly, we recommend earlier in the pregnancy because that gives your body a chance to develop immunity and will protect your baby too. And then if you choose to breastfeed or if you're able to breastfeed, your breast milk will also contain those antibodies from the COVID vaccine and protect your baby that way also.
Do you guys know anybody who can do COVID and pregnancy presentation for me? Because I'm looking for someone.
Yeah, I think we did do a COVID and pregnancy presentation.
Yes, at the beginning.
But we can, if you feel like you needed a refresher, we're happy to do it again. We can send you the PowerPoint, and if you can look it over. If there's other questions, just send us an email and we can do like a refresher with all the extra questions.
Okay, yeah, send me the PowerPoint, please, first. And then maybe we can do presentation, COVID and pregnancy. Actually, that's a good idea.
That was a few months ago. And so honestly, like things have changed. I don't think we had a booster back then.
A lot, especially.
Yeah. Yeah.
Thank you. Sorry to cut you off. Go ahead.
So as you progress along in the pregnancy, your appointments will become more frequent. And depending on if there's any extra concerns that you or your doctor have, you might even have even more frequent visits. But important third trimester appointments, and some of these can be done in the end of the second trimester, but gestational diabetes screen. You want to get your group B strep test, and that's kind of like a swab that goes into the vagina and then down into the rectum a little bit, and that tests for a set of bacteria called group B strep. And if you did have it, it's also very common. It's not necessarily considered like an infection. It's very common, but we would put on antibiotics prior to delivery of the baby. And that has really greatly reduced the risk of meningitis that for babies. This is something that is totally at your choice, but some people towards especially later in the third trimester are curious about what their cervix is like, and so they could opt for checking their cervix to see how much they've dilated, and depending on where you are in your pregnancy, we could also strip your membranes, which is kind of it's kind of like thinking about one of our attendings talks about, like you have your cervix, which is kind of like a little canal, and then a basketball that kind of like sits on top of it, and you kind of insert the finger through the cervix, and you kind of move move your finger around that basketball, and that kind of can start labor. It's another way to start labor without doing like a medical induction. But there's also many other natural ways to start labor, and that could be its own talk as well.
All right, I think this is our last slide, and there is so much to do for each individual person when they're preparing for their baby. But some things that we suggest is if you feel like it, celebrating your beautiful belly, taking pictures, or having a celebration with family, taking prenatal classes, and these can be not just it can be for parental figures or family members that are going to help care for baby, both like classes about the birth process, but also classes like infant CPR, or like how to do the Heimlich maneuver, just like things to prepare for safety classes for baby. And there are parent groups and support groups. One that I know of that I've had some patients join they're called like PEPS groups. I'm not sure exactly what it stands for, but they connect people who are going to give birth around the same time, that live in similar neighborhoods, and they can kind of like go on that journey together and like check in, like, hey, this is crazy, like my baby's not sleeping, you know, so they can go through the pregnancy and then the child, like raising their child together. People can do a tour of the hospital and see where they will be delivering, which can be really helpful to know, you know, so it's not such a shock when you get there, when you're in labor. Think about having a doula, which is amazing, and we always encourage that. Pack a hospital bag, so bring some comfortable clothing, some things from home, potentially like some music that you might want to listen to, or like special snacks that you might want to have, because, you know, depending on your body and your birth experience, you can be in the hospital for kind of a long time, and it's nice to have some comforts from home. Make sure that there's a good plan for childcare or for pet care, so that that's not something that's concerning you when you are preparing to, or in labor. And then if you have support people in your life that would want to cook for you or bring you food in those first, you know, weeks to months after delivering, when you're really sleep deprived and taking care of your new baby at home. And then make sure that the car seat is figured out. A lot of times hospitals will not let you leave until you have the car seat figured out. So it's good to get that done before going into the hospital.
Awesome. I actually just shared with you all via email the childbirth education classes that we are offering now. We're doing them in trimesters. Just started last week, I believe. And we're also, we have piloted a program called Black Bundle of Joy last September. And we were, you know, fortunate enough to get that program funded for a couple more years. So this is first-time parents, you know, for folks who identify themselves as Black, whether, you know, African Americans or people from the African continent. And so we're really excited about this program, and it's for first-time parents. It helps them, you know, be really prepared for the whole experience. And I just shared the flyer with you all, so hopefully you can share with your colleagues and everything.
Wow, I just looked at that email. Congratulations on getting the funding for that. That is so important and very exciting. I'm excited to share it with everyone in our program and our patients as well.
Thank you. Yeah, we really are excited about the program. I think it's one of a kind in definitely in Washington. So yeah.
Yeah, that is exciting. Okay, wow, we're already at the end here. Here's just some few resources. I mean, there's so many resources out there. And sometimes I feel like too many resources is a bad thing because you just feel overwhelmed. But I love the ACOG website that this particular link, you don't need like a special password or login for. It has some really great information on nutrition during pregnancy, and that other website that I was talking about, myplate.gov. And there is also a book out there, and I can't remember the name. I will find out and send it an email to you all. There is this book that kind of talks about just dispelling some of the myths around foods that are said to be avoided during pregnancy, and really goes into the data around what are the risks and incidence of those infections. But I think that's it. Yeah.
I've heard, yeah, I keep starting and not finishing it, but I've heard really good things about this one, expecting better.
Yeah. But the ones that we talked about, the infections and the recommendations that we gave are just our general recommendations for people that are pregnant to avoid. And I think I think maybe I've had 2 patients that had babies die from listeria. And so I'm very like cautious about it. And it doesn't necessarily mean that like you should avoid soft cheeses forever or, you know, whatever, when you're pregnant. But I just felt like it was important to kind of like reiterate some of those facts as well, because it was very much something that reflected this unfortunate statistics in racial health disparities of people that are pregnant. Are there any other questions? That we're so excited to be here and happy to answer any questions.
gabdha yaa su'aal qabo oo ku jiro. Oh, guys, by the way, there's a survey on the link. If you don't mind doing them quickly, that'd be great. And gabdho surveyga halay sameeyo oo aan soo geliyo link. Also, su'aal yaa qabo dhaqaatiirta intay naga tegin ka hor. Anybody have any questions?
Not questions, but maybe personally, I'm not pregnant and I'm not like, I think I've passed that time class, but I had concern. My daughter, she had a baby at Swedish, and I think the experience that she had there it was kind of discouraging, and until